So today we are going to discuss about the parotid gland. The parotid means it is around the ear. It is the largest of the salivary gland. It is about 25 grams, produces saliva. So the parotid gland is found, it is found in the parotid bed. So where is the parotid gland is located? So you can see the parotid gland is located here. This is a parotid bed, but what are the boundaries of this parotid gland? It is bounded above by the zygomatic arch and the external acoustic meatus. In front or anteriorly, it is lying over the ramus of the mandible. As you know that over the ramus of the mandible, you get the masseter muscle attached, and medially, medial pterygoid is attached. So anteriorly, the parotid bed is formed by the ramus of the mandible, and behind it is related with the mastoid process. So the muscles attached to the mastoid process is also forming the posterior bed. So anteriorly by the ramus of the mandible and the muscles attached, posteriorly by the mastoid process and the muscles attached to it, above by the zygomatic arch and the external acoustic meatus, and medially it is related to the styloid process and the muscles attached to the styloid process. So now we will see the coverings of the parotid gland. It is covered by two coverings. One is the true capsule, which is very closely attached to the gland, which is formed by the condensation of the fibrous stroma, and there is an outer false capsule which is having two that is called as a parotid sheath. The parotid sheath has got two laminae. It is superficial laminae and a deep laminae. The superficial laminae is attached to the zygomatic arch above, and anteriorly it blends with the masseter muscle that is forming parotido-masseteric fascia. The deep laminae is attached to the styloid process and the tympanic plate. So that is about the coverings of the parotid gland. The two coverings, inner true capsule, outer false capsule, which is called as a parotid sheath, which is having two lamina, superficial and deep lamina. The superficial lamina is unyielding in nature. So that is about the coverings. Now next we will talk about the external features of the parotid gland. So what are the features? External features, it has got an apex that is directed downwards and a base. This is the base of the parotid gland. This is the apex of the parotid gland, and there are three borders and three surfaces. The borders, this is the anterior border and this is the posterior border, and intermediate there is a medial border. So anterior, posterior and a medial border. Three surfaces are there. This is a superficial surface, this is the anteromedial surface, and here is the posteromedial surface. So it is like it is forming a wedge or it is having a groove-like structure. It is forming a groove-like structure. See, so this is a anteromedial, this is posteromedial. So anterior border, this is the anterior border which separates the superficial surface from anteromedial surface. So this is the posterior border which separates the superficial surface from posteromedial surface, and here you get the medial border. So there are three borders, three surfaces: anterior, posterior and the medial border, superficial surface, anteromedial and the posteromedial surfaces. Now the superficial surface is covered by the skin, superficial fascia and the platysma. Whereas the anteromedial surface, as I told you, it is related with the ramus, the masseter which is attached here, inner surface of the ramus, the medial pterygoid. The posteromedial surface is related with the mastoid process, the sternocleidomastoid. So this is sternocleidomastoid muscle. So this is the posteromedial surface relations. Now, what is the borders? Now we are talking about three borders: the anterior, posterior and the medial border. Now there are structures emerging from this gland, parotid gland. So anterior border, what are the structures emerging from the anterior border? You can see that the branches of facial nerve is emerging from the anterior border. So here you get the temporal branch, zygomatic branch, the transverse facial artery, the upper buccal branch, the parotid duct, the lower buccal branch and the marginal mandibular branch. So these are the structures emerging from the anterior border. Whereas the posterior border, the structures emerging are the posterior auricular artery and the posterior auricular nerve, which is a branch of facial nerve. Now from the apex, there are mainly two structures emerging, that is cervical branch of the facial nerve and the retromandibular vein. From the base, that is superficial temporal vessels and the auriculotemporal nerve. So these are the structures emerging from the borders, from the anterior, posterior and that is anterior, posterior border, apex and base. Now there are three structures found within the gland. Three structures found within the gland. One is the facial nerve, which is entering from the posteromedial surface, and the external carotid artery and the retromandibular vein. So these are the three structures found within this parotid gland. And you can see that from the anterior border, you can see this is the parotid duct, otherwise the Stenson duct. This, it is piercing the buccopharyngeal fascia, it enters into the vestibule of the mouth, and it opens into the upper second molar tooth. So this is the parotid duct. So these are the external features of the parotid gland.